Welcome to this video on lumbar puncture, part of the nursing mastery class for AIIMS and NORCET preparation, presented by Mr. Nagesh Sir of ND Nursing Coaching. Let's begin with a question. At which vertebral level is a lumbar puncture typically performed in adults? The correct answer is B, L3, L4, or L4, L5. This is done to avoid injury to the spinal cord, which typically ends at the L1, L2 level in adults. Next question. What is the optimal patient positioning for a lumbar puncture? The correct answer is C, lateral recumbent with knees drawn to the abdomen. This position increases the space between the vertebrae, making needle insertion easier. Moving on. What is a major contraindication for performing a lumbar puncture? The correct answer is B, increased intracranial pressure, ICP. A lumbar puncture in a patient with increased ICP can cause cerebral herniation due to rapid pressure release. What is the most common complication of lumbar puncture? The correct answer is C, post-dural puncture headache. This is the most frequent adverse event caused by cerebrospinal fluid or CSF leakage from the puncture site. Which nursing intervention is crucial immediately post-procedure? The correct answer is A, keeping the patient flat for several hours. This minimizes CSF leakage and helps prevent headaches while the puncture site heals. Next, what is the appearance of normal cerebrospinal fluid, CSF? The correct answer is B. Normal CSF is clear and colorless, often described as crystal clear. Bloody CSF at the beginning of the puncture that clears by the third tube suggests what? The correct answer is B. If blood clears as fluid is collected, it suggests trauma during the needle insertion, known as a quote, traumatic tap, not an underlying hemorrhage. What is the normal opening pressure of cerebrospinal fluid in an adult? The correct answer is A. Normal opening pressure typically falls between 5 and 15 centimeters of H2O. Elevated cerebrospinal fluid protein level is often a marker for what conditions? The correct answer is B. Increased protein in CSF can indicate blood-brain barrier disruption, inflammation like meningitis, or tumors. What does xanthochromia in cerebrospinal fluid indicate? The correct answer is B. Xanthochromia, a yellowish tinge, results from the hemolysis of old red blood cells, indicating bleeding, often a subarachnoid hemorrhage. Which tube collected during a lumbar puncture is typically sent to the laboratory for culture studies? The correct answer is B. Tube 2 is typically used for microbiology and culture to minimize the risk of skin flora contamination in the sample. What is a key nursing priority before the lumbar puncture procedure begins? The correct answer is A. Ensuring the patient empties their bladder prevents discomfort and reduces the risk of accidental bladder trauma during the procedure. Which cerebrospinal fluid finding is typical for bacterial meningitis? The correct answer is B. Bacterial meningitis typically results in low CSF glucose as bacteria consume the sugar and elevated protein levels. What is the primary purpose of the stylet during the needle insertion phase of a lumbar puncture? The correct answer is B. The stylet is kept in place to prevent epidermal tissue from being dragged into the spinal canal during insertion, which could potentially cause epidermoid tumors. If a patient cannot sit up for the procedure, which alternative position is considered safe? The correct answer is A. The lateral recumbent position is the safe alternative for patients unable to sit or who prefer lying down. What should the nurse observe for during the procedure? The correct answer is D. Constant monitoring of the patient's vitals, comfort, and breathing is mandatory for safety throughout the procedure. What if the patient complains of leg pain during insertion? The correct answer is B. Shooting pain indicates the needle may be touching a nerve root. The nurse should immediately withdraw the needle and reposition it. When can the patient resume normal activities? The correct answer is B. Limited activity for the first few hours is recommended. Protocols often suggest 1 to 2 hours of bed rest to aid healing. What is a dry tap? The correct answer is A. A dry tap occurs when no cerebrospinal fluid can be aspirated, usually due to incorrect positioning or a blocked needle. Which finding confirms viral meningitis? The correct answer is A. Viral meningitis often shows normal glucose levels and only mild protein elevation compared to bacterial infections. What is the risk of using a large gauge needle? The correct answer is B. Larger needles increase the risk of post-dural puncture headache due to a larger hole in the dura, leading to increased CSF leakage. What is a key post-op warning for the patient?